Hi, I'm Jennifer Corral, and I'm a drug dealer. I'm going to go into it today and explain to you exactly what pharmacy technicians do in the pharmacy in order to get you your medications up to the floor, or when you're in pain or whatever you need. One of the tasks that we do when you come in, if you're the Pyxis person for the day, which is adding the medications to the machine so that the nurses can get them out, you would take the meds up after a pharmacist has checked them and make sure that what you say is in that bag is actually what's there, so that the wrong medication is not going into the wrong compartment. So what we would do is we would take it up, all the medications up to the floor, and this is called a Pyxis machine. And the Pyxis machine holds the medication, and they're separated into separate QBs, what we call QBs, and they have a little microchip to talk to the computer, which is the whole Pyxis machine. So then the nurse will log in, and right here she'll go in and log in, and once they log in, your menu will come up and you will decide whether you need to remove a med or return a med, or you can go under your patient and pick it by patient. So once they do that, they would go in, select the patient that they're choosing the meds for, and then go through the list as to what meds that they need to take out for that patient for that particular time of the day. And then once they take out their meds, then they would close the drawer and they make sure that they log out so that nobody else can get into the machine under your code, because if they can, then they can do whatever they want to get in there. Okay, so that's one aspect. We also have to, sometimes the drawers fail on these machines, so we would have to go upstairs and fix them, recover them. We fill them with medications. We fill them with IV fluids, which we have regular IV fluids, which is either saline or dextrose, or you could have saline with potassium in it. Depends on what the patient requires. So that's the medications. That we also keep narcotics in there, which are pain meds, which is the main thing that we want to make sure that the patient is getting on time. Because if a patient's in pain, that's what they're going to remember, is make sure that they get their pain med, or they're going to, first thing you ask them is, are you in pain? And if they say, yeah, because I haven't been getting my meds on time, or I haven't getting, so we want to make sure that their meds are located in these machines so that they get them when they need them. So another aspect of the job what a pharmacy tech would do would be the IV fluids. If they need a particular fluid, if they need iron, we would get an order sent down to us, and we would, in the IV room, which we have hoods, we would stick the IV bag in, and then also the vial of the medication in order to add it to the bag, put it in there, the correct amount. We put the label on it, and then we also have to make sure that the pharmacist checks it to make sure that the right amount for that patient goes into that bag. So there's a double, triple, almost 4-time check to make sure that the meds are correct as to what the patient is to get. We also do chemotherapy IVs, which is the same type. You just have to make sure you're very precise with the medication and that you don't get it on yourself, because chemos are a pretty nasty process. So we just double check, we double glove for those. We use a separate hood because it has to make sure that it doesn't mix with any other medications. And we also do not put the medication for the chemos in the bag until the pharmacist double checks and makes sure that the correct amount is in the needle before we inject it into the bag. And then another aspect of our job is that we would answer the phones when the nurses call down and they have any questions to make sure that they're getting their patient's medications up to the floor. They're saying we don't have this, so they would send us a request saying I haven't received my medication for my patient. So we're just basically making sure that the patients are getting their correct meds, that they get them on time, and that they are having a comfortable stay when they get their pain medication. But there's a lot involved. We're busy all the time, and we just want to make sure that the patients get what they need. good.
Very good.
Very good, thank you.
Okay.